জুম মিটিং হচ্ছে 2 মিনিটের জন্য ঢুকে আবার বন্ধ করে দাও। ঠিক হচ্ছে না?
Anjan, we should start probably.
Yeah. So with due permission, Rudrajit.
Please start.
Abhimanyu, you join, na?
Yeah.
Yes.
Yeah, Abhimanyu, just do the Facebook live and then we'll start.
Rudra, give me 2 minutes. I have Facebook live. Are we kardo because I think host permission will be required.
Okay, just a minute.
আন্তর্জাতিক পরিচয় পর যোগ বেশ করে বহুবার করেছে এই অক্টোবৰৰ পৰা ৰিন'ভেশ্যনৰ কাম আৰম্ভ হ'ব বুলি জনায় ইণ্টাৰকোৰ্ছ সম্পৰ্ক চেণ্টাৰৰ সদস্য দীপক পাল লগতে তেওঁ অসম চৰকাৰ আৰু উৰিষ্যা চৰকাৰক ধন্যবাদ জ্ঞাপন কৰিছে A new chapter will be open in art, culture, and language cooperation in between these নগৰ উন্নয়ন বিভাগে ভাঙি পেলাব বিচৰা ঘটনা অসম চৰকাৰ আৰু উৰিষ্যা চৰকাৰৰ তৎপৰতা পুনৰ প্ৰাপ্ত কৰিব।
Okay, Abhimanyu, Benita, we are good to go, right?
All set. Yeah.
Okay, a very warm welcome to all the esteemed guests and honorable Rotarians to this district seminar on maternal and child health. One of the very important Rotary 7 area of focus, especially for our India. Today, we have among us some of the most renowned doctors who are not only well-versed and experienced in this field, but more importantly, they are all Rotarians at heart. So we are all poised for a very, very informative session on positive health for next 1 hour. So to start with, I request the president of the host club, Rotarian Gautam Pal, to offer the formal welcome address.
Thank you,
Rotarian
Rudra.
Gautam Pal is a member of Rotary Club of Silchar since 2001. A civil engineer by profession, served as a lecturer in NIT Silchar in 1983, and thereafter in PhD Government of Assam, where he retired as chief engineer in charge with more than 35 years of service. So over to you, Rotarian Gautam Pal, for your formal welcome address.
Thank you, Rudra. A warm good evening to one and all who are attending this special webinar meeting on a very important topic, mother and child care. We have with us District Governor Dr. M.S. Kaur, District Chair Health Dr. Pallavi Maji, District Chair Maternal and Child Health Dr. Anjan Pal, Senior Pediatrician, District Chair Nutrition and Food Bank Dr. Kiranmoy Das, Senior Gynecologist, Dr. Sukullan Das, Senior Pediatrician, and our MOC of this seminar, Rotarian Rudrajit Lashkar. I, on behalf of District T240, welcome you all. Maternal and child care is one of the 7 areas of focus of Rotary International. Friends, around 7 million of children under the age of 5 die every year due to malnutrition, poor healthcare, and inadequate sanitation. To address this issue, Rotary Club should undertake projects to reduce the maternal mortality and morbidity rate, improving access to essential medical services, trained community health leaders and healthcare providers for mother and child care, reducing the mortality and morbidity rate for the children under the age of 5. And lastly, to support studies for career-minded professionals to maternal and child health. Our beloved DG, Dr. M.S. Kumar, along with 3 eminent speakers, will speak at length on the topic, and I wish we can enrich our knowledge through their deliberation and implement them at our club level to address the issue faced by the community. I take pride in welcoming you all again in this special meeting. Thank you all. Over to MOC Rotary and Rudrajit Lashkar. Thank you.
Thank you so much, Rotarian Gautam. Now I request everyone to kindly raise for the national anthem. And if you wish, you can switch off your video and sing along with us for this national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उत्कल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तब जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you so much, everyone. Now, we have the first topic of today's seminar, which is under discussion, is how to reduce under 5 mortality, practical ways and means. And to present this is presenter of this particular on this topic is Rotarian Dr. Anjan Pal, who is a chartered member of Rotary Club of Silchar, past president and a past assistant governor of Zone 11.
Rudrajit.
Yeah.
And I think as per the agenda, it's an opening remark.
Okay. Sorry. I
didn't get that probably, I think.
Yeah. So I take the apologies, and the next agenda, which is on card, is obviously the very important one, and it is to be given by our beloved district governor, Dr. M.S. Kaur, who is a pediatrician himself. So he has the deep knowledge and thorough knowledge about this subject, and so he is the right person to start this with his opening remark. And so I will request our district governor, Dr. M.S. Dr. Konwar, to please offer the opening remark and set the stage for this seminar.
Thank you, MOC. Good evening to everybody. Especially Gautam, you have taken a decision to have under 5 and maternal mortality on this day. Friends, this is the most significant week in a pediatrician's life. This is called breastfeeding week. Today is the last day of the World Breastfeeding Week. What a significant day you have selected. And I really congratulate you for that. I have seen my past district governor, DRFC, whom I always see the evergreen, young at heart, die to go ahead with all the positive past district governor Arijita. My own assistant governor Harkishuri, I have seen Dr. Anjana, and all the speakers today, starting with Dr. Anjan, Dr. Sukalya, Dr. Kiranmoy, and presidents of the various clubs. Today, at just now, we are around 44 participants. This is a passion for me, exactly. Let me share a story where I was the MCs here, maternal health, child health here. I always think to do something different in the club from my president days, from my assistant governor days, or when I was here. From the president days also, I started some new things in my own club, say diabetes detection awareness, having other new things I didn't, which were not tried. And when I was assistant governor, that also I tried, say, our John LP seminar or something like that. And as a MCs, because my vocation is that at that time I was the IAP branch president. 15 to 17, I was Indian Medical Association branch president of Tinsukia. As a pediatrician, as a Rotarian, I'm a branch president. What was my topic? My concern was at that time the highest maternal and childhood under 5 mortality in my district, especially in the revenue district of Dibrugarh and Tinsukia, contributed highest to the kitty. Mortality was highest. So I thought, now why not utilize my expertise with government level and the WHO level and say district health authority, district administration, district social department. We tried along with one of my most junior Rotary, my colleague, gynecologist, Dr. Brennan. We both of us, we started one program. It's called MCS, how to create in the grassroots level training for the Anganwadi workers, grassroots level health workers, medical officers and the tea gardens, nurses. And we have that there are around 4 ABIT Assam branch Indian Tea Association branches in my Dibrugarh and Tinsukia district. Here there are 4 circles, started with Tingrai cycle. There we have trained around 500 to 600 all grassroots health workers about how to reduce the under 5 mortality and how to reduce the maternal mortality. And then again we started with the Margarita circle. It's around say around 70 kilometers away from the class. We went there, we had a meeting. There were around 2,000 grassroots level workers were there from tea garden, from health department, because and then we had Undunduma, then in very near our own Panetula circle, very nearby. It was in the year of PDG, Santuji. And really, that's a program I still love to do. And when I talk to the John about regarding this, can't we do something about this? As so many pediatricians, IPDG, I'm a PDG, Devasis, all are there, all doctors, are we not at all concerned about the maternal mortality and under 5 mortality? When we talk, I'm very thankful to our district seer, Maji, Dr. Maji Pallavi, and all the Dr. Anjan Pal and Sukalyan, and all doctors who are there. They have taken this very seriously. When I say that I will like to have a journal meeting on 7th, I said, why journal? Why don't you make it on the district level? Because the under 5 mortality stance is a very, very alarming. In our whole region, whole district, it is around 215 at the moment per Yeah, under 5 maternal mortality 215. So our target is to make it below 100. And by around, in Assam it is, can you imagine, it is a 215 per 1 lakh slave. But the national, our target by 2030 is 100. So we have to do something. How can we do that exactly? What are the causes? Why we get so much of maternal mortality? Why we get so much of, we'll have a very, very expert. I mean, Dr. Anjan, Dr. Sukalyan, Dr. Kiran, all are there, they are the experts. They will definitely deliver it. To my mind, there are 4 or 5 things very, very important. And we can fit into those places. Number 1, child and maternal malnutrition constitutes about 68% of the under 5 months. Can you imagine? Only the maternal and child health nutrition, that constitutes around 68.2%. Then the unsafe water and sanitation, I mean, contributes on 10.8%. And other thing is the air pollution. Of course, we are very lucky. This time, the 7th area of focus is environment. So air pollution is the one of the cause that also contributes about 8.8, because respiratory related diseases are more with when there is air pollution. So we have to reduce on that. And there are 3 more important things. The lack of proper healthcare facility, their accessibility, their affordability, their availability. Accessibility means you just see in some remote place, they still carry the mother, a lady during the time of delivery with a pull cart or in a cycle or a hand carriage or a rickshaw. Can you imagine we are in that state? And that accessibility is very, it's not there. And then affordability, when you cannot, everybody, all the below poverty, they cannot access to the private, I mean, sophisticated nursing homes. That is also not there. So we have to do something for this community, this downtrodden community. You know, our district, especially Northeast, we up to the, say, Sikkim, Darjeeling, we have a lot of tigers. It's all inhabited by Adiva people. There, if you see, there are some regular workers, there are non-regular workers. Because the private sector, they keep some private, non-regular and regular workers. They do not provide the basic health facility to non-regular workers. So here we can put in our service there. Here the mortality rate in amongst this is very high, and Assam and Northeast, and especially Bengal also, there is a land, I mean, full of rivers. There are soil areas there. There are people from migrated from other places. I cannot say they marginalized people. They have, when I happen to be there in the, I mean, Malda for a polio program, I have seen there near the Ganga basin, people, how poor they are exactly. Titaltala, Teltala, those places, I don't remember. I went there as a polio, polio service. I went there a health worker there on the polio day. We went there. I have seen how in the soil areas they're living. What is the condition of these people? Don't you think that as a Rotarian, we have to do something for these people living, marginalized people in the soil areas, in the, say, tea garden areas, or outside the tea purview of the tea garden areas? Can't you do something on those people? And with this, if you, I really thank that you have taken Gautam, Anjan, and Sukalyan, Kiran, you have taken this subject. This is how to reduce this under 5 and maternal mortality. What are the things where our Rotary can fit into? Here, where we can do, what we can do for the community. To my mind, there is few things we can do probably. First and foremost, nutrition education. Nutrition education, we have to take it very seriously. The locally available food, we are always neglecting. The family norms in the lower or middle class family, you see one or two sizes, they are pampered size. There is a few days back, I have seen one paper, smart screens, no grains. Can you imagine they from the say small family now, nucleus family, mother, father, small babies there, and what the mother will do? They will put mobile in front of her, and every baby of 3-4 months, and she will do the household chores. It's such a bad, and that develops the having of the baby with the smartphones. And you see the incidence of obesity. If you see the malnutrition, under and over, both are important. Overnutrition is say obesity is also, that has become a very, very prominent problem in days to come. Now incidence is around 17 per 1,000, probably it will be around say 25 to 27 by after 2025. This is a projected. Here we can do probably one of the nutrition education. What is locally available? How can you take our children to our locally available food, homemade food, nutritious food? If we can do that, that will be a very good thing. And yesterday I have come across a very alarming news, alarming statistics. You know that India is the largest consumer of sugary sweet beverages like Coca-Cola. Those things are there. And they are not at all, nutritious, but kids did like it. Kids they take it from the. This is a alarming thing we got to think. We got to educate that what is there we got to think. Number thing, then the safe and portable water. It's probably we have got a very good program, WAS in schools programs, and a lot of clubs are doing, a lot of presidents, they can do WAS in schools and safe water drinking. That's it will be at least give it, if we can give them the safe water, probably diarrheal disease under the all contagious disease will be less. And this is the thing probably we got to think about. And environment, that the last thing, where we can reduce the air pollution by around, solid waste management, tree plantations. I'm really grateful to all presidents, all Rotarians of my district on last 17, 18. Despite the COVID, restriction, you have taken a peek with the plantation inside the house and inside your compound and outside also. It's what the thing you have started. The source of oxygen, when we get it, that day I'm really taken by old persons. He was in hospital for COVID, taking the oxygens, pre-flu, pure oxygens. When he was given the bill, he was crying. Everybody, health authority came. Why are you crying? He said, I'm crying for those trees, those plantations who are giving oxygen from the whole life. I am not crying for the bill exactly, it is because we are neglecting, we're cutting, we are doing the deforestation, what is that called? We are destructing our environment. So we got to think deeply about that. And probably as a Rotarians, as an active Rotarian, we can think about the improving health facilities, especially as a pediatricians, Sukwalya, Anjan, everybody will know what is the major cause, because the neonatal mortality below 28 days mortality is the maximum. Around 60% of the under 5 mortality because of the neonates. Experts are there, they will deliver. And if we can help as a Rotarian, as a president, giving some, safe feedbacks, and then some neonatal apparatus, if we can, that will not be costly. So if we can, that will also help in the community in the long run. With these viewers, this is my thought the giving, and I really thank the organizers. Whenever you think, go Tom and all, whenever think that this is the thing, this is the subject from the core of my heart. I love children. I love working with the, downtrodden, and I really sincerely hope my district, all the presidents, has to have something to do differently, think differently, to do something differently, so that we can be of service to the community. Thank you very much. This is, I don't know how much I have taken, but over to Rudrajit Warrior. Thank you. Continue.
Thank you so much, District Governor. It is indeed, as we mentioned earlier, you have the thorough knowledge about the subject. You have all the facts and figure under your fingertips. So, as I said, it has set the ball. And so, thank you so much once again for sharing your knowledge and your experience with us. So we'll move to the next agenda, which is the first discussion, which is under on this seminar. So, and the first topic that we have today under discussion is how to reduce under 5 mortality, practical ways and means. And the presenter is Dr. Anjan Pal, who is a chartered member of Rotary Club of Silchar, past president and past assistant governor, Zone 11. And Rotarian Dr. Pal is having experience of more than 30 years as a pediatrician and is well known in the valley. Dr. Pal is a recipient of prestigious IAP Pioneer Award in 2008 and also received IAP Shishu Visheshagana Award in 2019 by IAPA Northeast Pediatrics Association. Ladies and gentlemen, here is Dr. and Dr. Anjan Pal. And just to mention, we'll also have a Q&A session at the end of the seminar, and our panelists will be more than happy to take few questions. So you can write your questions on the chat box or raise your hand if you have anything to ask to our panelists. So over to you, Dr. and Dr. Pal, for your deliberation.
So good evening, everybody. I am audible?
Yes, very much audible, sir.
Please give. I am going to speak on the subject how to reduce under 5 mortality, practical ways and means. So, Rudra, please slide.
Okay, just a second. There's a presentation on the screen. You can go ahead, sir.
No, there is nothing is coming. Rudra?
Yeah, just a second.
Yeah, we can see the screen now.
Next slide. Yeah. So I'm going to speak on the subject how to reduce under 5 mortality, practical ways and means. Next. So what do we mean by under 5 mortality? Under 5 mortality rate is the probability for a child born in a specific year to die before reaching the age of 5. So this under 5 mortality includes here the most important parameter. One is the infant mortality rate. We design infant mortality rate is a death within 1 year of life. Neonatal mortality rate, death within the 28 days of life, and under 5 mortality. So under 5 mortality includes these 3 parameters. Next slide, please. So how we calculate this under 5 mortality? The ratio of under 5 child death registered in a given year to the total number of live births in the same year, as expressed by rate per 1,000 live births. This is a calculation how we do this under 5 mortality. A simple equation is that number of death under 5 years of age divided by number of live birth in the same year multiplied by 1000. So this is the under 5 mortality, how we design or calculate it. Next. So before that, we should know the parameter. What is the India position right now of the indicator or target for this program, maternity and child health program? As infant mortality rate, it is seen that 29.98. It is just around 30 per 100 live birth, and our target is to bring it to 20. And neonatal mortality rate, the death within the 28 days of birth, it is at present 209, is 1.7, and our target is to bring it below 15. And under 5 mortality is 34. Our target is to bring it less than 25. If you compare with the developed country, the present scenario is that Japan, USA, Australia, Iceland, they are all less than 4. So just you can think that our parameter is so high. This under 5 mortality, including IMR, NMR, and under 5 mortality. Next slide, please. So if you find the see the causes of this under 5 mortality, I have divided in 3 ways. One is the early neonatal mortality, 0 to 4 weeks. Most important is the low birth weight and prematurity. A birth child should have 2.5 kg or more, and it should cross 37 weeks of gestation. But if in India, there are lots of low birth weight and prematurity, these are one of the important cause of under 5 mortality. Next is the birth injury and difficult labor. A child should born in a good place and a good institutional delivery is always preferred. So there should be less chance of birth injury and difficult labor. So you can reduce the under 5 mortality. Next is the most important is the infection. If you do not take the sepsis care, aseptic care to be taken before the delivery of the child. Next, there is a congenital abnormality. This is another causes of this early neonatal mortality. And another most important is the acute respiratory infection, pneumonia, and other causes of infection which causes the early neonatal mortality. And another important cause is the diarrheal disease. We'll discuss this thing in the subsequently. And next is the tetanus. Tetanus, neonatal tetanus is a very neonatal tetanus is another important cause of early neonatal mortality and hemolytic disease of the newborn. Next slide, please. So post-neonatal mortality, this is from 1 to 12 months of age. Another important is the diarrheal disease, acute respiratory infection, communicable disease like tuberculosis, typhoid, malaria, measles, HIV, and recently added this pandemic coronavirus infection, malnutrition, another most important parameter, and congenital abnormalities. Next, please. And from 1 to 5 years, top causes of the post-neonatal maturity, again, is a diarrheal disease, respiratory infection, malnutrition, infection, malaria, anemia, and another important is the accident. Next, please. So these are the important causes in defined age group, defined age groups. So how we can, next slide, please. Seeing the causes, how we can prevent this? Now, factor affecting neonatal, infant, and under 5 mortality. Number 1 is the birth weight. As I already told, a birth weight is very important. A child should have born at least 2.5 kg or more. And age of the mother. In India, there is lots of early marriage. So a mother should have a reproductive age groups like 18 years to 45 years. And there should be a birth spacing. At least 3 years of spacing should be there. And multiple pregnancy. Sometimes there is a multiple pregnancy, 2 or more pregnancies. So there is a risk for this under 5 mortality. And family size also very important. A overcrowded family causes lots of problems, lots of infection for the babies. And economic factor, cultural and social factor, early marriage, and quality of healthcare. It is very important. Until unless we give a good quality of healthcare to the babies and child, so mothers and child, we cannot take care of the babies because the baby is born in under 5 or another. So there's a good health of the mother and the child. And brutal habit and custom in many parts of our country, girl child is not welcome. So we should not have this brutal habit or custom. So these are the factors we affect the under-5 mortality. Next slide, please. So how we can prevent? Number is the through MCH clinic. We can provide prenatal nutrition, as our DJ rightly told that during pregnancy, all need many important nutrients, making healthy food calories. Everybody help and give your baby what he or she need to develop proper amount of for weight gain. So we give a good nutrition to the mother so that mother can take healthy food so that we can give the good nutrition to the inborn baby for a proper weight gain. And that is the prevention of infection. Neonatal tetanus, one of the important cause of child mortality. So if you give 2 doses of tetanus toxin to the mother in the pregnancy period, so we can prevent the tetanus, neonatal tetanus. Next is the universal immunization program. Next slide, please. Universal immunization program, it is very important to immunize our child. Prevention is better than cure. One of the important causes of pneumonia, measles, diarrhea, H-influenza infection are the important cause of infant and under-5 mortality, which we can easily prevent by simply immunizing our child. If we follow the universal immunization program, and recently in many states, also in Assam, the pneumonia vaccine was started to immunize our child. So if you can take the help of this immunization, so we can really prevent one of the greatest under-5 causes, pneumonia, measles, diarrhea, etc. And club can hold regular immunization clinic, and if not possible, awareness camp can be arranged. Government health setup can be utilized as per UIP schedule. You all know Rotary helped to eradicate polio from the world. Now only 2 countries having polio, Afghanistan and Pakistan. And next, our important step is the MR and MMR vaccine. If you can give this vaccine to all of the child, so you can prevent measles. Measles also one of the important cause of pneumonia, which is called post-measles bronchopneumonia. So we should immunize our child. You can take the universal immunization program setup. Next slide, please. Next is the important is the awareness of breastfeeding. Every year, from August 1 to August 7, as our DG told, we are celebrating breastfeeding week. Today is the last day of breastfeeding celebration week. So everybody knows what is the benefit of breastfeeding. I'm just giving you some important one. Benefit of breastfeeding for the babies: lower risk of infection, pneumonia, otitis media, weight gain. A baby giving the regular breastfeeding is weight gain is very preferred. Low cost, it does not cost any money. Malnutrition we can prevent, and family bonding. These are another important mother and child relationship. Next. So these are the important, there are so many. Next is the benefit by the mother. Benefit one is the important is the bonding. Next, it is easily available. Lower risk of breast cancer, ovarian cancer, less endometriosis, less osteoporosis, less diabetes, less cardiovascular disease, and many more. So if you look at the benefits of breastfeeding, so we must take the breastfeeding to our child, every child, up to exclusively up to 6 months of age. Next slide, please. Next. So World Breastfeeding Week. World Breastfeeding Week is the annual celebration with every year from August 1 to 7 in more than 120 countries. World breastfeeding is the effort including breastfeeding promotion, support, education, research, progressive trends, and normalizing breastfeeding is the gold standard of infant nutrition. We don't need anything else except the breast milk up to exclusive after 6 months. So health professionals recommend exclusive breastfeeding up to for the 6 months with a gradual introduction of appropriate family food in next 6 months and ongoing breastfeeding continue for next 2 years of age. Next slide, please. So after the benefit of breastfeeding, next is the prevention of diarrhea. You see, just for your knowledge, the important cause of lower respiratory infection pneumonia is causes 17.9% of the death. Preterm baby is 15.6%, and this diarrheal disease causes 9.9% of death of the under 5 pregnant. So this is very important. But if you simply take care of something, we can easily prevent this diarrhea. One of the important cause of diarrhea under mortality is the diarrhea and dehydration, which we can easily prevent by access to safe drinking water, use of improved sanitation, hand wash, good personal and food habit, health education to prevent infection. And Rotary is doing lots of school health program, wash hand program. So indirectly we are reducing the diarrheal disease. And nowadays, rotavirus vaccination is available. This is an oral vaccine, 2 doses to be given within 8 months of age. So if you give the vaccine, it is available in the government setup UPI program also. So if you give this vaccine, easily we can prevent rotavirus diarrhea, the most important cause of under 5 mortality. Next, please. And next. Next, if the patient having diarrhea, the most dehydration is one of the most common and most severe effect of diarrhea. So it is caused due to loss of water and electrolytes to stool, urine, vomits, etc. So we can prevent dehydration by simply giving ORS solution. World Health Organization low molecular ORS is available everywhere in the market or also in the government setup. Or if it is not available also, you can give homemade ORS. We can easily made in the home in a glass of water, expenditure of sugar and scope of sugar and salt. So that way we can give these homemade ORS, and if we give frequently once a baby started lose motion, so we can easily prevent dehydration and we can prevent under 5 mortality in that way. So we can do program on ORS and prevention of diarrhea. Next one. So another important, the most important cause is the pneumonia. So pneumonia, I am going to discuss anything because Dr. Sukollan is there. He will speak on the childhood pneumonia. So we'll listen to him. So this is another most important cause of under 5 mortality, pneumonia. Next. So another program we can set up is the deworming program. National Deworming Day is an initiative of Ministry of Health and Family Welfare, Government of India, to make every child of the country worm-free between the age of 1 to 14 years. Every year, February 10 and August 10 are observed as National Deworming Day. Rotary can adopt several schools and do this program, one of the important cause of malnutrition and anemia. So we can set up this program also, as it is mentioned, February 10 and August 10. So we can take a program all over the Rotary Club of the district. So on the same day, we can observe this deworming day. Next. So we can do this program. We can take the help from National Health Mission so that every delivery should be in the sub-center or primary health center, community health center, district hospital. They are providing 24-hour service. So if you take the service of them, antenatal, internal, and postnatal care, including iron and folic acid supplement to the pregnant and lactating mother for the prevention of anemia, and engagement of the ASHA workers for healthcare provider to the community. And ASHA workers are doing excellent work. They are giving in-person immunization program and also iron and folic acid and lots of program they are doing. So we can also get the help of them if we need. Next. Next, please. So few lines, earlier one, please. Earlier one, withdraw. So few lines about the COVID-19 now that it is going on in the children, and data suggests that children and adolescents under the age of 18 years represent 8.5% of the reported cases of COVID-19, with relatively fewer deaths compared to adult and usually having mild to moderate symptoms. However, cases of critical illness have been reported as many centers called MISC, multi-system inflammatory disease syndrome in children. This is a dreaded condition, and lots of cases are reporting nowadays. Of course, this is a post-COVID infection reported 3 or 4 weeks after the COVID. And experts suggest that third wave may affect children more, and they are at risk that no vaccination is available for them. They suggest prevention is the best medicine in that case. Next. So there is a, next please. There is a ICMR. Next. There is a ICMR guideline. So in order to protect our children and other family members, one should prevent contracting the virus simply by following the COVID protocol suggested by the ICMR. Wear a mask in public, wash hands well and often, avoid public indoor spaces, especially restaurants and bars, stay at least 6 feet apart from people you do not live with, make sure kids get all recommended vaccination other than infection like flu and MMR. It is very important thing because due to COVID, we are missing lots of DPT cases, polio cases, other normal UFA schedule vaccination. And now it is very recommended that if you take flu, MMR vaccine, we can prevent other flu vaccines and vaccinate all the adults above 18 years of age. If you vaccinate all the adult members, if they vaccinate, so we can indirectly prevent our child. Next. So with this discussion, what we aim to know what is the Rotary's mission for that. So Rotary can do maternal and child health clinic with the help of IAP, Indian Academy of Pediatrics, or FOXI, gynecologist, which we do in Silchar Club, but it is not possible in all the club. But you can do awareness camp, regular awareness for maternal and child health, immunization clinic, besides UPI program, pneumonia vaccine, other vaccines to be given, diarrhea control program we can adopt, ORS program we can adopt, and awareness of breastfeeding program, deworming program, malaria control program, and as Didi rightly said, child obesity prevention program we can undertake. And in the present pandemic situation, mental health, because children are staying in the home, they are problem, lots of mental problem. Mental health is COVID crisis for children. So this is a program we can adopt by the Rotary in different Rotary club, so that we can indirectly reduce the under 5 mortality. Next. So thank you very much. I have given my email and phone number. So any queries, you can feel free to talk to me. Thank you.
Thank you so much, Dr. and Dr. Pal, for enlightening the audience and the guests and the Rotarians on the right way on how to reduce under 5 mortality and what Rotary can do and what the initiatives Rotary can undertake to further enhance our reach and do the good work in the society. Thank you so much. And
can
audience,
take questions at the end, no?
Yeah, we'll take the question at the end.
At the end,
yeah.
Please.
Yeah. So if anyone has any question, you can write down on the chat box, or you can raise your hand at the end of the session. So our next topic is childhood pneumonia, and the presenter is Dr. Sukalan Das. Dr. Sukalan Das did his post-graduation in pediatrics from Assam Medical College, Dibrugarh, and had an illustrious career of more than 25 years in this field, now serving as a specialist in the Civil Hospital Shivsagar under National Health Mission for last 5 years. He keeps an interest on neonatal care and emergency pediatrics. A chartered member of Rotary Club of Shivsagar and is the president-elect for 2022-23. Dr. Sukallan, the screen is all yours.
Okay, am I audible to you all?
Yes,
Yes, yes.
audible, sir.
Let me share my screen. Please allow me to share my screen, Rudrajit.
Yeah, just a minute. Yes, you can do it now.
Yeah. Share. Rudra, now you have disabled me.
No, I have given the co-host, right, Dr. Shuklandas. You were there as a co-host.
Yeah. So that I can move the slide. Yeah.
Yeah. You have logged in with your only one ID, right?
Yeah. Yeah. So can you see my slides
Not yet, sir.
now? Please check.
Not yet.
One sec.
I think you have two different logins.
Yeah, I have got two different login because
Yeah, that is why we are having
So
trouble.
which is the other ID I need to?
Yeah, we need the other ID also. The one that is on the screen on your laptop.
Okay, I'm putting it my laptop.
Yeah, no. We need the ID that you are logged in the laptop, because we have made you co-host with the ID that is giving you this camera.
Okay.
Which is the other ID?
Yeah, that's what I'm asking. What is the other ID? Is it the SK Das? I don't.
Now, please put me into your slide share.
Yeah.
Dada, are you logged in as also as Rotarian SK Das?
Anjana, can you help?
I think he has Dr. Das. He's logging as
Dr. Das got it. Dr. Das got it.
Okay, you have to give this.
Yeah, that co-host that has been given to Dr. S. Dr. Das as well. Now you can try once.
Yes, now we are seeing it. Yeah, we can see it now.
Good. I also, Sukalyan, can start. Sukalyan, start.
Now you can see it now.
Yeah.
You can hear my voice also.
It is there, but some disturbance is there with the audio. But you can start, so you can say.
Audio. Hello. 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 Could you hear me?
Yeah, we can hear you, but there is a disturbance though. But you can go ahead.
There's some buzzing sound, like, you know.
Yeah, there is some echo sound is there.
ৰবি এটা বন্ধ কৰি ল যিটো তই ইউজ কৰা নাই।
Hello, now can you hear me?
Yeah. Yeah.
Sound clear?
Yeah, we can hear you.
It's better.
Okay.
It's clear.
Okay. Good evening, dear friends. Respected beloved District Governor Dr. Mohan Sham Kumar, President of the Host Club, Silchar, Mr. Gautam Pal, President of my club, who is always patronizing me, Mr. Manav Borua, and both the co-speakers of today's evening, Dr. Anjan Pal, Dr. Kiran Moy Das, all my senior brothers, and my fellow Rotarian friends of both the clubs present in the meeting. A very good evening to you all. Dear friends, it's a privileged moment for me to be with you, all the learned members of the Rotary Club, of the Rotary platform, and having an interactive session on mother and child health. You have already learned from Dr. Anjan Pal about under 5 mortality and its practical ways and means. I was given the responsibility to deliver some knowledge on childhood pneumonia. So dear friend, in my talk, I will try to be as simple as possible, avoiding all the medical terms so that all of you can understand the problem in a very simple way. And as Rotarian, can model some projects to relieve our society from this curse of pneumonia. So now I progress. I have named my subject topic as KAP, means know about pneumonia. Sorry. Am I audible now? Could you hear me?
Yeah, we can hear you.
Yes, we can hear you clear.
Let me try to move the slide. So you have seen it now?
Yeah, your skin is also very much visible.
Okay. So the word KAP, I have put it in other way around also. You will see the K first stands for the knowledge. So in this speech, you will learn about what is pneumonia, what causes it, how and where it happens, how it is manifested, how we treat the case, a little bit of that, and how it can be prevented. That is the most important part of today's talk. Next, A is the attitude. After learning about this pneumonia, there is something in your mind. So your mind is in a set point now about pneumonia. And now you have a feeling. Now you'll have a feeling about the disease. And after that, you will have a settled way of thinking about that pneumonia. Your brain will do these activities for you. And the last P is the practice. Now, the Rotarian friends with this attitude in their mind about pneumonia will have to try what can we do in the community level to prevent pneumonia or to lessen the burden of it. So this is the KAP, know about pneumonia, or knowledge, attitude, and practice about pneumonia. So already Dr. Anjan Pal has described what is under 5 mortality. I am just point out a few things. It is the probability of dying between birth and exactly 5 years of age of a child. That is, the child is born, but the child could not have his 5th birthday. And it is expressed by 1,000 of the live births. That is called R5 mortality. It encompasses newborn mortality and infant mortality. Let us see the world picture of under 5 mortality. Despite a lot of advances in the science and the medical science, 15,000 under 5 children die per day in 24 hours in a day. They die, the tragic part of it, they die from largely some preventable causes. The causes can be prevented. About 80% of this death occurs in Sub-Saharan and South Asia. 6 countries: China, India, Pakistan, Nigeria, and Ethiopia, and Congo. They contribute half of all the under 5 deaths. Tragic part is India is among them. In 2019, the global burden of under 5 deaths is about 5.2 million. Just imagine, don't try to remember all these statistics, just imagine the pictures of it. That will be in your mind. So what is the under 5 mortality in India? The infant mortality rate, death per 1,000 live birth in India, declined from 89. We have achieved something, we have not achieved anything. We cannot say like that. We have achieved a lot. India, it has declined from 89 in 1990 to 28 in 2019. We have declined our infant mortality rate, reduced our infant mortality rate. The country registering 679,000 infant deaths in 2019, which is a significant decline from 2.4 million deaths in 1990. The country has witnessed a decrease in the neonatal mortality from 57 to 22 in 2019. This is a resource from the Hindu, the newspaper. So what is in India? We have gone to a little bit of more statistics. There is some sex-specific under 5 mortality rate in India. In 1990, 122 males and 131 females of under 5 mortality. Now this has declined to 34 males and 34 females in 2019. So we have declined a lot. We have reduced it a lot. But still, our country accounts for almost 1/3 of the total global burden of the under 5 mortality. So we cannot just sit idly. We'll have to work because our country contributes about 1/3 of total burden of under 5 mortality. So what is the scenario in Assam? According to National Family Health Survey, Assam has declined of under 5 mortality from 66.5 in 2015-16 to 39.1 in 2019-20. We are achieving. It is not that we are not achieving anything. Despite of this swift reduction, check the swift reduction, look at the swift reduction. 32 children, still 32 children per 1,000 live births died before turning 1, the first birthday in Assam. Our neighboring states, Manipur, Nagaland, Arunachal Pradesh, Tripura, have the same picture. But Mizoram is the exception. Mizoram has reduced the under 5 mortality to a great extent. So over past 30 years, health services and dedicated health organizations, social groups like Rotary, they are doing so much work and persistent for the cause of reducing under 5 mortality that millions of lives are saved. We still have large role to play to eliminate this preventable cause of death. See what is alarming about under 5 mortality. If this trend goes on and we sit idle, we do nothing about it, 48 million children under 5 years of age will die between 2020 to 2030. And half of them are newborns. This is so alarming statistics. More than half, 50% of the deaths will occur in the sub-Saharan Africa, about 28 million, and 25% in the Central and Southern Asia, that is about 12 million children will die under 5. So what are the basic causes of this under 5 mortality? We have already come to know about this from Dr. Anjan Pal's speech, but just enumerating them. This preterm and the low birth weight baby. Preterm means the baby born before 36 weeks, completed 36 weeks gestation, and low birth weight baby is less than 2.5 kg. A lot of birth complication happens to the baby during birth. Neonatal infection was one of the major causes of neonatal death still in India. Pneumonia, one major cause of it. Diarrheal diseases are there. Malaria is there. And one important, another cause is malnutrition. So what are the risk factors? Poverty. Malnutrition from the maternal side. Once the mother is pregnant, mother suffers from maternal malnutrition. There is resulting in the fetal malnutrition and the newborn malnourished infant. It is a chain, it goes on. Poor accessibility to the health checkup programs of the mother and child. There are a lot of programs for the mother and child, but they are less accessible to the underprivileged group. Poor vaccination coverage. There are always some constraints of the resources. Lack of safe drinking water. Air pollution, the major thing that is happening nowadays. Poor awareness of the general uneasiness for the health. And definitely the illiteracy, one of the major causes and the major risk factors of our under 5 mortality. Do you have some goal? Yes, there is a goal to look at. This Millennium Developmental Goal aims to reduce the under 5 mortality by 2/3. MDG goal is about reducing the under 5 mortality by 2/3. MDG target is 42 per 1,000. And luckily, India is moderately on track. India is doing something. Always I'm saying it from beginning of my talk that we are doing something actually. We still need a sharper focus to improve the child survival by managing neonatal and childhood diseases. We have to focus everything very minutely about the cause and the preventable cause of the under 5 mortality. Our key challenge is to reach the underprivileged group who has the little access to the health service. This is the thing the Rotarians will have to do. These key challenges, find out the key challenges. We'll have to work for it and look for it. So let us go briefly about this pneumonia. I will not go into the total medical ways of speaking about the pneumonia. Pneumonia accounts for about 15% of the deaths of children under 5 years of age. It killed about 8,694 children under the age of 5 in 2017. It is caused by bacteria, it is caused by viruses or fungi. Pneumonia is a form of acute respiratory infection that affects your lungs. Lungs are made of millions of air sacs, which in a healthy person remains filled with air, which help us to get oxygen and eliminate carbon dioxide. But in pneumonia, what happens? They are filled with pus and fluid, which makes breathing difficult, painful, and limits the oxygen intake. So the baby cannot take oxygen properly. So what are the causes of pneumonia? Pneumonia is always caused by some infectious agents. Don't try to remember all these agents. These are bacteria like Streptococcus pneumoniae, Haemophilus influenzae type B, respiratory syncytial virus, it is a virus. In infant infected with HIV, there is another specific Pneumocystis cerevisiae, is one of the most common cause of pneumonia and a major cause of death in HIV infected infants out of pneumonia. So how the virus is transmitted or the bacteria is transmitted? Virus and the bacteria that are commonly found in child nose or throat can infect the lungs if they are inhaled. They also spread via the airborne droplets, via from the cough or sneeze. What we are now scared of the COVID-19 infections, the COVID-19 pneumonia. Pneumonia may spread via the blood, especially during and shortly after the birth of a newborn. But there needs to be a lot of research to be done about the transmission of the pneumonia, because it is important for the treatment or the prevention of pneumonia, because we have to learn about the how it transmits, because that is the important point, the target point to look or check the disease pneumonia. So how it presents? The common symptoms are cough, fever. Fever may be mild to severe. There may be difficulty in breathing. There may be fast breathing. That is the most important thing. The child will show the age that we have got age-related number of breaths per minute in a children. But when it crosses, the child goes into a fast breathing. What medical term it is called tachypnea. Chest wall indrawing. The video, small video, you can see this is a 2 days old newborn in my unit who is suffering from congenital pneumonia. He has acquired this pneumonia from the mother. The baby is having a fast breathing. You can see. You can see the retraction, the how the chest are going inside. This is a not a normal thing in a baby. Sometimes you can hear the wheezing in a child. And severe cases may be unable to feed, they may become unconscious, they may be hypothermia, they may be convulsion, the baby may become very serious. So what are the risk factors of pneumonia? Children who are healthy, well-nourished, with well-developed natural immunity, boosted with immunization, can fight the infection. But children whose immune systems are compromised, they have not been vaccinated, are at the higher risk of developing pneumonia. A child immune system may be weakened by malnutrition. That is what is happening to the underprivileged group. Undernourishment, especially the infants who are not exclusively breastfed. Remember this, exclusive breastfeeding. No feeding except breastfeeding up to completed 6 months. That is what we are saying in this week, breastfeeding week, World Breastfeeding Week, that baby should be given nothing else except breast milk for the first 6 months of their life. That prevents a lot of things in a baby. Pre-existing illness, there may be some pre-existing illness in the baby that may cause or precipitate pneumonia, like measles. There may be symptomatic HIV. Also increase the child risk of contracting pneumonia. Another important factors for risk factors is the environmental factors, which increases the child's susceptibility to pneumonia. Indoor air pollution caused by the cooking and heating with biomass fuel like wood, burning of wood and burning of cow dung. That gives a lot of air pollution in house. Living in a crowded, congested house, congested living, this all happens in the underprivileged group, and the Rotarians have got a lot of things to do for them. One important factor is the parental smoking, leading to secondary smoking. If the father smokes with his baby on his lap, baby indirectly inhales the smoke of the cigarette. That is called secondary smoking. I have mentioned another smoking, that is third end smoking. Third end smoking is nothing that after smoke, there is a particles of tobacco that remains in the environment that again goes into someone's lungs again. This is the third end smoking that has come up recently. My colleague who is tobacco control program, Dr. Udayat Rajkot, he's an Rotarian, he's doing a lot of works on this smoking, the prevention of smoking. So treatment, I will not go to the details of the treatment. It is a bacterial origin. Pneumonia are treated with antibiotics. We all know about it almost. The amoxicillin and the cotrimazole are used both at health centers and the community level also. It is used nowadays. It is also used in the district hospitals also. And some severe cases of pneumonia needs hospitalization always. Prevention, this part is most important for us. Preventing pneumonia in children is an essential component of a strategy to reduce under 5 mortality by immunization. We have got a lot of vaccines that prevents pneumonia. One is hip vaccines that is available in the UP program. Pneumococcus vaccine, PCV, recently included in our immunization schedule by the government of India. Measles vaccine we have got, and also the pertussis vaccines. All these vaccines now, influenza vaccines also prevent the Anjan Pal has mentioned about the MR and the MMR vaccines. All this prevents pneumonia in children. So we Rotarian must keep an eye on the underprivileged children, whether they are getting this immunization or not. If they are not getting, we may take some projects to get them immunized. Adequate nutrition. The child should get adequate nutrition. It is like a key to improving child natural defense. It is a key. You can open up the natural defenses of the baby by giving proper nutrition. What I have mentioned earlier, the exclusive breastfeeding up to 6 months, and timely introduction of supplementary feeding at 7 months of age. Nutritious meal for growing child. Vitamin A supplement. A healthy diet reduces the length of illness in a child, even if the child gets pneumonia. If a child was having an healthy diet, suppose accidentally he gets contracted the pneumonia, he will get well soon. He will not go into a very severe stage. Addressing the environmental factor, how we can address the indoor air pollution. We can address by providing affordable, clean indoor stoves. We'll have to go and check what are the cooking media they are using. We can give some affordable, clean indoor stoves, alternate fuel for cooking like methane, LPG, natural gas, and a properly channelized biogas or the gobar gas. A special care of the HIV infected child, like regular cotrimoxazole therapy is important. We Rotarians can look after all these. Simple hand hygiene, simple technique of hand hygiene should be taught to every parent to prevent pneumonia. Adequate housing facility and ventilation, that is most important. So wherever you stay, the room should be well ventilated. And this can be done by providing fan in the home and the small schools, so that the child, while studying in the home or while studying in school, gets a good ventilation. We must try to give safe drinking water and good sanitation to the child. Prevention of overcrowding is the home and the school that must be tried to eliminate, so that child is, wherever the child is there, it is not over-congested, overcrowded. We'll have to try to improve the education level of the underprivileged group, or to improve the literacy, to know about the disease. They should know about how to prevent it, and we must help them out to get rid of this cause of pneumonia. Dear friends, everything talks always now include this COVID-19. The countries worldwide is experiencing about, for last 1.5 years, more than 1.5 years of the COVID pandemic. We are now experiencing it. Still it is there. There is a total disruption of the child and maternal health services. I forget about the COVID disease in children. COVID disease in children is not a very risky practice. Children are not affected much, all we know. And whenever they're affected, they will not go for a very serious disease. We all know it. But what is the main problem of this COVID? What is the after effect of COVID, or the current effect that is going on is that there is a total disruption of the child and maternal health services for the children. There is an extensive dropout rate from the routine immunization. Babies are not brought to the hospital for immunization. They are not coming for the regular health checkups in the hospitals. This is due to the resource constraints and general fear of attending a hospital to getting the COVID. They are so scared of getting the COVID, they do not bring their child for the normal health checkups and immunization. That is what is the most problematic thing that is now coming up. Hospitals and healthcare systems are overrun. They are hospitals and doctors and healthcare workers all are busy with COVID. There is no one to look after this pregnant mother or the newborn or the under 5 children. So hospitals are all systems are overrun with this COVID-19. Mothers are afraid of delivering their baby in the hospital. We are always trying to have a baby in the institutional delivery, but mothers they hesitate to come to the hospital for the delivery for fear of getting COVID. In this disrupted symptoms system, it is, if not managed very urgently, we will lose many under 5 children, especially newborns, in coming years. All Rotarians try to remember this. This is what is happening with COVID. So it is, again, we are all speaking from the Rotary platform. So what is this talk? What is the relation of this talk on pneumonia, the disease, and the Rotary? Remember, my friends, all of you know the Rotary connects more than 1.2 million members, more than 200 countries and the geographical areas who dedicate their talent and time to tackle the world's most pressing humanitarian challenges. Rotarian is doing it. The most impactful project is polio eradication program we have done. India is now celebrating the 10th anniversary of polio-free India. So remember, Rotarians, everything is possible for the Rotary and the Rotarians. You can do, always keep it in mind. So I want to conclude my talk with a comment of an amazing personality. I love this personality, T. Jacob John. He's an eminent virologist of India. He said, by ending polio in India, the national gain to the economy is about $400 million. Nobody recognizes Rotary as a wealth creator, but it has done just that. Look what Rotary has done by saving, making polio-free India. It has saved $400 million. It has produced that amount worth of money. Dear friends, the estimated expenses for the management of pneumonia is around $109 million per year. Can we create this amount of wealth for this world where we live in? We can. The question is to you now all. From today onwards, with this, after my speech, get an attitude in your mind that you can do something for creating this amount of wealth for the world where we live in. Thank you for your patient hearing. And I thank my daughter who stays in Mumbai, who has helped me a lot with designing this projection. And my son Piyush, he has done his social work master degree from Don Bosco University recently. And I thank my spouse also, who has helped me a lot in having this talk. Thank you all. Thank you for the patient hearing.
Thank you so much, Dr. Das. It is indeed a very thorough presentation. And I must also like to acknowledge that this presentation has got my attention because it has got some very innovative insertion in the form of GIF and videos. And so I think all the audience who has seen this presentation now and those who are watching us online must be benefited by your deliberation. Thank you so much for sharing your knowledge and expertise.
Thank you so much. Thank you.
Now, moving ahead, I'd like to request our next speaker, Dr. and Dr. Kiranmay Das, the last topic of the day, and it is maternal mortality rate, how to reduce, and presenter is, of course, Dr. Kiranmay Das. Dr. Kiranmay Das, DGO MD in obstetrics and gynecology from Assam Medical College, Dibrugarh in 1988, presently working as an endoscopist and consultant, the gynecologist KC Nursing Home, Silchar. Dr. Kiranmay Das is a past president, Rotary Club of Silchar, past secretary, Gynecological Society of Silchar. So over to you, Mr. Dr. Kiranmay Das, for your deliberation on maternal mortality rate, how to reduce
Good evening to all. It's the last session, and I think each and everyone is a little tired. But first of all, let me extend my warm greetings from Rotary Club of Silchar. Feel honored, and it's a proud privilege to speak before all the leaders, leading leaders of our district 3240. I am thankful to DG, my president, chairman, assistant governor, and all others for giving me the opportunity to talk on this challenging subject to reduce the maternal mortality. As all the learned participants already knows, the problems of high mortality rate in India, it is better an exchange of knowledge rather than a presentation. And I will be delivering my speech more as a Rotarian than as a specialist gynecologist. To go to the subject of prevention and its reduction, I think we need to know a little bit of brush up of our knowledge of what is maternal mortality and how it is calculated and what is the present scenario and what are the causes. So in a simple way, the maternal mortality is the number of maternal deaths due to birth or pregnancy related complication per 1 lakh live births. Now, why we are telling it that it is a challenging subject? Because the global scenario of maternal mortality, the latest is around 211. And India, now it is reduced to 112. But still, it is one of the 6th contributor. It is the largest, one of the 6th largest contributor in maternal mortality. Why I'm saying so? That because there are developed countries like Norway, Belgium, where the maternal mortality is less than 2 to 4. And there are many countries where the maternal mortality is less than 10. But let me say, there are countries like Nigeria, Southern Sudan, where the maternal mortality is more than 1,000, 1,500. And although we are lagging behind, our gynecological society, Federation of Obstetrical Society, most of the time are sending delegates from India to Nigeria to help them and see how best and what best we can do. Another very important thing in India, if it is 112, but it differs from state to state. And the Assam is one of the biggest, highest contributor of maternal mortality. It's still around more than 215. Whereas in southern states like Kerala, Andhra Pradesh, Tamil Nadu, and others, it is below 40. West Bengal is being better, it is below 90. So staying in Assam and for the Northeast, for the district 3240, is really a tough task. And it is our responsibility as a Rotarian to bring it to the standard national level. My dear friend, I'm telling about the bad things. That is what is happening. But the good thing is that for the last 5 years, as our previous speakers, like Sakulla and others, my DJs are telling that we are doing wonderful job from India as well as from Assam by reducing this maternal mortality rate by 25 to 30%. And one of the greatest satisfaction by the central and particularly with the state government is bringing the more delivery patients. It was in 2015-16, it was around 65-67 hospital delivery. But now it has gone more than 90 to 95%, 93%. But as rightly pointed out by Dr. Sukallan, that due to this COVID situation, again, due to so many problems, we are finding many difficulties to tackle or giving our best service to the pregnant woman. Now, coming to the causes, because before we come to the what best we can do to serve, to change the lives of pregnant women. That is what our RI president thinks this year. So I'll just try to avoid the medical terms, but let me say what are the major causes, why there are so many maternal death of the pregnant woman. The number one is what we call hemorrhage or bleeding. This may happen before delivery, it may happen during delivery, or it may happen after delivery, which is the most dangerous thing. It is very difficult to manage this postpartum hemorrhage. Yes, still infection and sepsis is one of the leading cause of maternal mortality, particularly in the rural areas. There is one disease called eclampsia. As you all know, it is something like stroke, which happens particularly in pregnancy due to high blood pressure. This is one of the leading cause. I say one of the leading cause, but nowadays, because of the proper management and proper care, the mortality and morbidity due to this disease and this disease occurrence of this disease, the prevalence of disease is drastically reduced. The very important thing is, of course, the anemia, that is lack of blood. This has direct effect, it has indirect effect of causing this maternal mortality. I'm telling you indirect effect, why? Because some of the patients who are from rural areas, as all the time my DG and others are telling, nutrition is the main thing. With 7 grams, 6 gram hemoglobin persons, they become pregnant. And suppose a little bit of blood loss during pregnancy, before pregnancy or after delivery, when they have no bank reserve, they are already in minus. So with little bit of blood loss, they lost their life. This is very tragic. Others, of course, the technical things, obstructed labor, what we tell, this prolonged labor, due to this position of the baby, big baby, the baby's mother's organs are not small and all these things. They're coming late, they become obstruction, and sometimes there may be rupture even to the uterus that carrying the fetus. So these are things are happening, and of course, day by day, the number of this type of obstructive labor are being reduced. Another very important cause is, of course, abortion. And when we call abortion, this is unsafe, unplanned, and illegal abortion. Yes, this should not be there. And there where we need some awareness. Apart from that, comorbidities like cardiovascular disease, hepatitis, diabetes mellitus, and other causes, heart disease, and all also gives a lot of morbidity, and it increases the maternal mortality rate. Now, these are the direct causes, but what are the indirect causes? And my previous speakers all have said about the age. In developing countries, we have two scenarios that each and every speaker was telling. Then one, the richest one, the poorest one. While I'm telling about the age for reproduction, we are getting still 15 years, 16 years, women becoming pregnant. They are married 13, 14 years. Although government has taken so much of steps and it has now decreased that rate, before 18, no one can do it. What is the ideal age? Because the female reproductive system is not developed before 18. It is better to have not to have any pregnancy or marriage before 20. And the ideal time is around 25 to 30 years. It should be less than 20 to 30. But we are getting another scenario. That is urban areas. There are a lot late marriages. Patients are not trying to become pregnant because of their career or some other problems and all. And they are becoming pregnant after 35 years of age when they are associated with comorbidities like hypertension. They are prone to develop hypertension, diabetes, other diseases complicating the delivery. May not have this mortality rate higher, but morbidity is there. So this is the two things, age variations we are getting in town, in urban area, and rural areas. About the parity also, that means number of children. Yes, some of the couples nowadays, as you know, do not want to become pregnant. Well, some of the patients are coming at the age of 23, 24 with 5, 6 pregnancies. And while taking history, surprised, sometimes really it is painful to know that most of the time after their pregnancy, they were pregnant. One issue within 2-3 months, another issue, like this. So you can well imagine what will be their nutrition condition and how healthy the baby will be. And when it is the grand multi, apart from that, there is chance of hemorrhage, chance of complications during delivery, particularly the postpartum bleeding is much, much more. And this is one of the leading cause of death in pediatrics. And as rightly said, malnutrition and anemia before pregnancy, along with illegal abortion, are the major causes. Indirect causes, when we discuss, as a Rotarian, we must think about and tell about the lack of education. When it's a lack of education, there is social stigma. They are confused. They do not know what is good, what is bad. Two types of patients we are getting in urban. Well, there is overeating. There is a stigma that pregnant women should eat more, one for herself, one for the children. Completely wrong. On the other hand, in rural areas, they're not given any medicines or any nutrition because they think that if they take all these medicines or if they take iron, vitamins, or nutrition, the baby will be bigger and then it may end in operative delivery. And they will be given to do everything more than what they usually do. There will be harder works will be given. They will not be allowed to sleep and all these structures and everything because of the stigma associated. So these are the things as a Rotarian we should take it how to what best we can do to make them aware of the fact. Apart from that, as you all know, there is lack of infrastructure, road communication, and we also have this lack of medical and paramedical staffs. So when the infrastructure is not there, transportation and communication is not there, there will always be late arrival of the patients. So for the last 5 years, what we have seen that it is improving. So one of the things is, as I have told, there is more hospital delivery. It is rising from 68 to 99%. Then the central and state government planning implementation like maternal and child healthcare and NRHM is doing excellent. As my DG was telling, rightly pointed out during his short speech, that government and some and most of the NGOs even are giving incentive, particularly for the tea garden laborers. Governments are giving incentive for the female born children. Governments are giving incentive those who are delivered in the hospitals. Governments are giving incentive for the family planning, and one of the right thing to go for family planning is just after or during, just after the delivery, because this is the right time the patient can be motivated. So from the government side, they're trying harder and harder, and we are improving a lot. Our target was by 2020 is to 100 maternity, to reduce it to 100, and we are just around 112. And our next target, I'm sure that we will be do much more than better. By 2030 it is 70, but I think we will be doing much more better. So along with this, the few things are going on that is appreciable. And one of the good things going on is empowering the women. And we all as a Rotarian should be very happy that our RI president has given a lot of importance to the women empowerment. As rightly said by our previous speakers, that it is not the time that during pregnancy you will give them the nutrition and give them the education and she will deliver a healthy baby and she will have a healthy life. No. From their childhood, we must identify, we give them the nutrition, we give them the education, we give them, take care of them, and we need to give them health education, sex education, everything, so that they know and they can take their own decision. So literacy, if we combine with giving them the little bit of nutrition along with literacy, so they will know what are the good things, what the good diets they should take, how they should, what they should do, their menstruation, what precaution they have to do during menstruation, what steps they should do, the blood loss during menstruation, and very important things. Everyone knows that pink mission is there, where government is giving has tied up with Federation of Obstetrics and Gynecology. That a good thing. In every school there is a the blood levels of hemoglobin levels are being checked, and iron and folic acid are being given along with calcium if possible. So these are the initiatives taken by the few things by the government and other NGOs. But what should be our strategies to reduce the MMR, this maternal mortality rate? So the guidelines are, number one, to place high priority on maternal and child health care, that is MCH, and that is being already implemented. Number two, we should give more attention to care each and every delivery labor particularly in the most critical period of complication. And there we are lying. Because still now, more than 25 to 30% of the labor cases are being unattended or attended by unqualified person. And when some complication happened, there is no one to tackle. And when it is being referred to a hospital, it is in a great condition. So this is where we need to play as a Rotarian some role. More importantly, we should provide community-based delivery center which can provide a clean and safe delivery. And that should be better to be close to their home, because all we know that there is a communication and transport problem. So if we can do some satellite centers where this normal delivery or uncomplicated delivery can be done, then there will be more institutional delivery. The community service will be better and they will prefer to go there because there is lack of communication, lack of transport, poverty, economic condition. All the labor patients are still not coming to the nearby hospital. And it is always better to keep a maternal waiting room in each and every hospital, because as you know, in each and every hospital, there may not be a bed. All the hospitals are not having indoor bed in remote hospitals, but at least keeping a waiting room where if someone can identify a patient being as a high risk pregnancy, then it can be referred immediately. We need to improve the quality of MCH care at rural community level. I mean, where this hospital delivery centers like PHC, because there are a lot of patients and the junior doctor who is not probably a gynecologist, is not, maybe some other expertise in some specialist in other health subjects. And you all know that one doctor may sometimes have to see 250, 30, 300 patients per day. So it is very, very difficult when a delivery patient or pregnant patient comes to examine them, to take proper history, thorough examination, laboratory tests. It is sometimes not possible. So there we need to concentrate that which patient they have to keep, and that is only possible if a thorough examination can be done and their blood test and minimum investigation can be taken. Here I want to tell you one very important thing, that a patient in labor is better or best to be examined at its first arrival by a senior or by an expert gynecologist. Because this is, if we take a wrong decision, and if we cannot assess the outcome of the labor, and if you delay the process, we are losing the patients as well as the baby. So while doing so, there should be improved quality of primary health center and emergency care and proper system of referral. We need to have ambulance, we need to have other stuffs. We also need to include postpartum program in MCH and family planning service, because if we can include this postpartum program, yes, we have already included, but it needs better implementation so that we can reduce the number of children in a family. It's better to have not to have more than 2, because India, as you know, is already more than 140 crores. And this is giving lot of economic pressures. And we are overburdened. The doctor's patient ratio, the patient's paramedical ratio are not as far as norms. One important thing is that we need to give blood transfusion, and that blood transfusion without any time, as early as possible, sometimes we have to give. But it is not possible to have blood bank in each and every corner. But we need to think about the feasibility of a network of service of blood bank. If we can have a network which can provide by telephonic consultation to the, you can quickly give 1 unit of blood, you can arrange for the patient. So if you can start it and refer the case or do the other, then it will be beneficial. Because time we are losing, particularly in delivery, and if it is because of blood loss, then as early as possible, we need to do all our best of service. And while doing so, yes, again, we need to improve the transportation and the road condition. Very important thing, as I am telling, is to empower the women. And how to empower is by educating the girl and giving them health and sex education. And it should come, and it is coming to the school level. That is very, very important. But that is not the end. We need to aware mass education of the community so that they know what is good, what is bad. Why? What is the importance of checkup, antenatal checkup? We tell that before, during delivery, every month the patient should come to see doctors. At least our hemoglobin, blood pressures, and all these things are being checked. And if there is any complications and anything they find it is a high risk one, it should be referred to the referral hospital. To focus obstetrics and gynecological training primarily on practical skill in the management of labor and delivery. Here I'm telling you one thing. Very recently, as all of us, most of us are from Assam, that IMA Assam has done a wonderful job by examining for 7 consecutive days last month, 1 to 7, the hemoglobin of all the pregnant women. We, along with civil hospital, the private practitioner, civil hospital, medical college, all gynecologists, most of us participated. And we are taking the data, what is the level of hemoglobin level in particular area and what best we can do. Now the IMA have done another very important thing. Already they have done in 2-3 areas. They are training the doctors as well as the paramedical staff. This is called skill training, and explaining them how to tackle what are the things, how to identify them, the high risk patient, what are the normal routine procedures, how best what. So this is one thing where Rotary can involve and take the help of Federation of Obstetric Gynecology Society, IMA, and others, along with the health department and other organizations and NGOs. More research work on reproductive behavior, as this type of study like anemia in pregnancy, blood level of school children, particularly the teenagers, girls. So these are the things we can do. Ultimately, we need to assure every woman the right to safe motherhood. As I was telling, that we all should be very happy that this time our not only our DG but our RI president in giving so many importance on women empowerment and focus on maternal and child healthcare. When I was a president in 2018-19, I started along with my club members the maternal and child healthcare. We were doing once in a month OPD along with Indian Pediatrics Society. Dr. Ranjan Pal was president at that time. I was the secretary of Gynecology Society along with health department. So health department used to give us this ANM, they used to come. We had a tie-up with pharmaceutical companies like Juventus and others. They used to come, they were doing the hemoglobin and blood sugar level, and the sister also, they were coming. So mother and children all are being examined. We did not have the induced system of delivering. From there, we could identify the high-risk pregnancy, and we then referred them, or we used to take them to the civil hospital, medical college for free of delivery and giving them their best. So that was running for the last pandemic, as Rotary and Dr. Shukullan was telling, there was some breach because of this pandemic situation. So I think this type of arrangement can be done, or we can have this mother and child OPT in some remote areas, but this should always be, it should be followed. It's not that 6 monthly or 1 yearly we will go and we will do it. Wherever we take, we should take in and around our community a center, and constantly we should monitor it, and we should take the responsibility. And I think Rotarians can do everything they want. Apart from that, during my tenure, I distributed around 25 to 30 Doppler machine for monitoring the progress of labor, particularly the baby's heartbeat and all this. This is a very easy procedure. It is not that too costly, only 2,000 around per set. But by stethoscope or fetoscope, it is very difficult for the sisters and paramedical staffs to assess all those things. With this Doppler machines, it is very easy. I have given it to even to medical college, civil hospital, in some of the PhDs, and they are getting extreme good results. I have a request to my DG to, if you have a district grant of fund like this, but you already told that 3 things we can do. One is this Doppler machine study. Another thing we can give this delivery kit, and of course another one is neonatal baby resuscitation kit. These are the things where necessary. We can, if we can give them, it will be very helpful. Now, this type of, apart from giving it, this awareness program is very much necessary. And we can do it with other NGOs too. During 18-19, when as a president, we started as nutritionists come, and this time the DG has chosen me as chairman, nutrition and food bank committee. So I want to share that during my tenure, our club has decided to start giving breakfast to all the underprivileged students, because we came to know that although the government were giving this lunch or midday meal, but most of the students were not coming, and there are a lot of lots of dropout students. So what we started, we used to give them little bit of nutritious food, someday banana, with a biscuit, someday eggs, someday other items. So like this, we used to give 1,000 children to different schools during my tenure. And we started one food bank. And after getting this sort of, while doing all those things in the community service, we got a good response from Indian Food Banking Network. They tied up and they started giving a sponsorship for this project. So this is a good idea to start better nutrition for the poor students, needy people. As already highlighted by our previous speakers, that they are also, we see in the school or teenagers, two scenarios. One, the undernourished hemoglobin is less. Another, obese patient. They are always fond of. My battery is becoming low, so I'll be just concluding the remarks. So they are suffering from this polycystic ovarian disease because of this your high quality of taking this fast food and all. They are obese and they are prone to develop all this cardiovascular disease, diabetes, hypertension in later part of life. So there we need to counsel them. So if we start our awareness programs in the schools, if we do the maternal and child care camp in and around our community and or remote areas, and if we can partner others like IMA, FOXY, Federation Gynecological Society, this Indian Pediatric Society, and others, then I think
we can take two short program, and probably we are overstretched time like anything.
Yeah.
So we can discuss two things later on also. Probably.
Okay. So I'll conclude it with that I am blessed as a gynecologist to see the smile of the mother with the first cry of the baby. So let's all praise, let's all the Rotarian please to enjoy this sort of enjoy this type of enjoyment, to have the mother to smile and baby to cry, and let us serve better to change the life of the would-be mother or pregnant woman. Thank you all, your patient hearing. The time is short and I indicate.
Thank you so much.
Good presentation by Dr. Kiran. Right? Practical things you have done exactly. What are the things needed? Why we get a maximum maternity? Thank you very much. Thank you. It's a really need of the hour. What we can as a Rotarian feed into those things. Thank you very much. And now over to Rudra, please.
Yeah, thank you so much. So before we move to the Q&A session, because we have to send two questions up there in the chat box, I'd just like to announce that on 29th of August, we have one district seminar on COVID vaccination for pediatrics, basically, and that will be hosted by Rotary Club of Burdwan South and Rotary co-hosted by Rotary Club of Katwa. So I hope all of you join there once again. And so we have to quickly take the two questions, then we move to
Rudolji, excuse me, you got to announce about the district membership seminar on 22nd and Agartala.
Okay, so that was not on 20. Yeah, sir, you can mention that. I have not much knowledge about that.
Yeah.
So we have a district seminar on membership, and that will be hosted by Rotary Club of Agartala and the other clubs of Tripura, basically, who are supporting them. So now quickly move to the questions. We have one question here. Yeah, one question from Rotarian Binapani, and the question is, though it is not part of the subject that we have today, the question is, especially during this COVID pandemic period, how to take care of psychological effect to children under 5 years. And this question is from Rotarian Dr. Binapani from RC Shivsagar. So any of the panelists or even our DG sir can also answer this.
Binapani, probably this is the problem in these many small family, wherever there is a small grandchildren of yours, exactly this is a small family, pampered child, they're being kept inside the house during the COVID pandemic. And this is really as a psychological problems are coming up, especially more taking to the screens. They are not taking the proper diet. They are taking the some, the hyper dose sweetened drug. And when they are taking to the TV or mobile, they're taking more foods, becoming obese. Those things are coming exactly. So we have to make them a bit active. First and foremost, make them the active. Do not, ask them to allow with the play with the toys like mobiles and all those things, mobile game, etc. We should avoid. We try to take away and at least allow them to have some, like a grandma like you. You can have a very good storytelling. Those are the golden days. They were the good things exactly we can think about. Thank you very much, Minapati. Hello, anyone?
Yeah, thank you so much, sir, for your answer. Any more question, anybody? With last question we will take before we move to our. So can't see any questions. So I quickly move to our District Chair Health Mission, Rotarian Dr. Pallavi Majhi, for formal word of gratitude from the district team.
Good evening to all again. I'm really privileged to propose a vote of thanks, being the chair of health, both preventive and curative. Firstly, I feel happy and elated to see our beloved DG in full-fledged, fine and organizing such topics on health. He's looking healthy and fit.
Wow, thank you. Thank you.
I thank Rotarian Gautam, the president, for arranging such a beautiful seminar on health. I'd love to express my gratitude to all the speakers, Rotarian Dr. Anjan, Rotarian Dr. Kiranmay, Rotarian Dr. Sukalyan, for such an organized speeches. Due to time constraint, we couldn't elaborate the discussion, though I feel we need more to talk on implementation of this shortcomings of health. And since we don't have much of time, we can talk if we need at least one-to-one with these speakers in personal level. I thank Rudrajit for such a good and excellent MOC. And I also thank those who are beyond the screen. I think Avimunya is there.
Yeah.
And for beyond the screen, and who had used their expertise to organize this seminar so well. And finally, and last but not the least, I extend my gratitude to all the Rotarians and others who took their time out of their busy schedule to attend this seminar and enrich themselves knowledge about all these medical updates and to some extent implementation of such updates by the presidents who are also, or not all, but most of all, are not doctors. So once again, I insist we should talk more on implementation, if possible, one-to-one with all the speakers, and if needed, in another seminar, in another time-bound seminar, like it shouldn't be extending more than over. So thank you very much. Thank you, DG, for giving me this opportunity.
Thank you.
Thank you so much, Pallavidi. It is always a pleasure to hear from you. and always like to see your smile. That is give some energy at the end of the day. We had a long session though, and I think, but at the end, with your smile and with your word of gratitude, you had made it really lovely for all of us. Thank you so much.
Thank you.
Only one suggestion to DG: this sort of seminar should have been for one full day.
Yeah.
Yes.
Limited
yes,
time is not
The
sufficient.
implementation is very
Yeah,
important. Like,
Yeah, and yes.
how to, this was
But
more
even
of a
then,
medical seminar.
even then, it is excellent, and it is very informative. Where all those research person has done excellent at their at par with their excellence.
Yeah.
Thank you.
Yes, Rita, let us continue because this is the probably initial stage.
Absolutely, absolutely.
Yeah, absolutely. Let us take the initial step and then go
Good.
step by step.
Yeah, we can
Good.
we can do this type of program in near future also.
Yeah.
And
Kiran probably
yeah.
we can do. Kiran also. Sorry, I had to interview because time is almost 10.
Yeah.
But we have to be precise and especially Anjan. We got to think this. How can you implement this thing in the Rotary exactly?
Yeah, definitely.
Exactly.
Definitely.
Let us try.
Anjan, Kiran, I have mentioned about the measurable some methodology that we are looking into it. I will be helping my DG. That whatever work we'll be doing in the field, yes, you have suggested, you all three have suggested, that should be measurable in our district. My question is,
if you want to reduce the underfed mortality and MMR, we have to do what? We have to do what?
Absolutely.
When doing a meeting and we're not going to help. Practically,
no, absolutely. Practical thing has to be out.
Anjan, I always think about practical things.
Yeah. And Silchar Club is doing something. We are having a MCH clinic. We have an immunization clinic. Regularly we are doing.
That is what I'm telling you. Take your Silchar Club to all the clubs in our district.
Yeah.
Thank you, Bina Baidu. Still there.
Thank you.
Like to share something?
Good night.
Bina Baidu kiba kobo? Bina Baidu kiba kobo? Unmute. Bina Pani Hazarika Rotary, senior member. So, attentive. You like to say something, Baidu? Thank you. Anyway, thank you.
Thank you, DG.
Good night.
Thank you, DG. Take care.
Thank you, everyone.
Yeah, thank you. Good night.
Okay, good night.
Good night. Thank you, Danida. Thank you, Ananda, who has left.
Danny was there.
Nice
Danny is there. Okay. How can Danny be missed? No? Okay, Danny, thank you.
Good night.
Good night.
DG.